One of the biggest problems in the United States today is the lack of affordable health care for our citizens. Many times candidates have tried to address this issue, but no ideas have succeeded. Today I'll be addressing my ideas for the nation so we can finally get a start to affordable health care for all people. I'll be talking about small business health care plans, free menstrual products in schools for all girls, and my statewide health insurance plan. I'm excited to share these ideas with you all, and I am hopeful that these plans will be implemented with what our nation needs. With regards to healthcare, small business healthcare plans. Currently, 99% of all New York State businesses are small businesses, and these small businesses make up 7.2% of the national total. Many of these small businesses don't offer healthcare plans, or if they do, it comes at too high of a cost to employers, with not enough benefit to the employee. On average, the employee will have to pay $947 premium on their health insurance plan after the employer contributions. Although this price seems reasonable for health insurance, many of these employees are making minimum wage or around that for their annual salary, and it comes to about $25,000 a year. If that is the case, many of these employees would not be able to afford a $947 health plan. Another aspect of this health insurance plan that needs to be scrutinized is how much it costs for one day of inpatient at the hospital. On average, it costs $1,673. With a health insurance plan like this one, you'll end up having to pay for most of that hospital bill. This is the reality that we must face. Health insurance plans that no one can really afford don't truly take care of these medical expenses. So what I propose is that we have some government subsidized plans for some of these expenses are allocated back to the rich, paid for through taxes, or you pay into your medical insurance based on your income level. New York legislators have just passed the compulsory supplying of free menstrual products in New York public schools for young women from 6th to 12th grade. With 42% of New York families living in poverty, the additional cost of menstrual products can put a strain on families who are already struggling, and to have young women and their health pay that price is unacceptable. New York is now the third state to pass such a law requiring these health products in schools, and I intend to bring this to the federal level to propose that every female student nationwide have this access. New York is now the third state to pass such a law requiring these health products in schools, and I intend to bring this to the federal level to propose that every female student nationwide have this access. The way I would introduce this legislation is through the amending of public health law to make such access mandatory in public school bathrooms. In New York, this push for legislation was brought after concerns of young women who couldn't afford these products were unable to have the same level of productivity during the school day, comfortability, and even could prevent students from attending school when they felt too embarrassed by not having access to such products. No student should feel inadequate during school or for something so simple but crucial as the availability of menstrual products. As a campaign, we do our best to understand the struggles of everyday Americans. The expense of healthcare and quality health insurance is a reality that damages many families in New York State as well as the country as a whole. Much like our studies on the wage gap, we believe that implementing an extensive study with the goal of finding out which demographics struggle with healthcare access the most. Once we've figured out which people we need to target, we will be launching our own statewide health insurance program. Funding this program is something I am sure our critics will scrutinize. However, we have a plan. All tax on medication, whether over-the-counter or pharmaceutical, will be allocated to this healthcare benefit. Additionally, all employees in New York State will face a slight increase in income tax to help afford this benefit. In order to qualify for this healthcare program, you must have lived and worked in New York State for a minimum of 3 years. Once you begin receiving the healthcare benefits, you must stay in New York State for 1 year every year you are receiving the benefit. This will encourage people to live in New York State for longer periods of time and will also encourage people to move to the state to receive this benefit. If you are living in New York State but are unable to work, an exception will be made based on property tax or other household incomes. We believe it is important that those who work in New York State and are paying New York State tax be given general health benefits if their employer does not already offer them. Overall, I believe that everyone should have access to the proper health care benefits and plans. I believe it is a right people should possess. Like I have stated previously, one of my first motions will be to implement a nationwide plan to bring menstrual products to schools free of charge for all girls. This will hopefully take the burden off of struggling families and allow them to have the care they need for their children. The next issue that will be implemented is our statewide health insurance program. Funding will be coming from the taxes on both over-the-counter medications and pharmaceuticals. Putting this plan in action will hopefully keep people in New York State longer since you must be in the same state for a year or more to receive benefits. With these ideas, I'm hoping to give people more access to affordable health care, taking the burden off of struggling families. I'm Devin and I approve this message.